What I know about vaccines, there's nothing about spina bifida that is a contraindication to getting a vaccine. When we talk about vaccines, of course, there's all the vaccines that you get as a baby. And so working with your pediatrician to make sure, and your family working with the pediatrician to make sure that you're on the right schedule for all of those vaccines. They're really important in preventing childhood illnesses that we've almost eradicated.
What you should be providing or offering to patients with spina bifida is exactly the same as you should be offering to pediatric patients.
It's not just about protecting ourselves. There's a whole host of vaccines that we've all been getting since we were little.
There's nothing about your health having spina bifida that would prevent you from getting the vaccine. So you should be able to tolerate the vaccine. Of course, making sure your doctor knows about your latex allergy. But besides that, there's no other reason why you should be able to get vaccines.
People are scared and fearful and don't necessarily have the same degree of trust in sort of the big institutions in our country, and that includes healthcare. Unfortunately, that's contributed to some of the fears and misinformation and hesitancy when it comes to vaccinations.
There is a lot of misinformation. And once you get misinformation, you get more misinformation. Talking to your primary care doctor, who hopefully you have a very trusting relationship with, and realizing that they are thinking about your best interest and hopefully are open to having any sort of discussions.
The statistics are overwhelmingly in favor of the safety of the vaccine. You have a much higher percentage of probability of getting very sick from COVID than you do getting very sick from vaccination.
As a parent and as a medical professional, I would say that, again, I think it's one of the best discoveries of the 20th century is vaccines.
Getting older, I think about the HPV vaccine as being a really important one. Pediatricians may treat people with spina bifida differently, may not think about their sexuality and sexual health in the same ways. So it's still really important to be offering and giving that vaccine. Pediatrician, again, should be talking with you and your family about it's a series of vaccines, but it's been shown to decrease the risk of cervical cancer, which is a preventable cancer. And so it's really important, I think, the HPV vaccine. So all the data out there shows that vaccines are safe and are effective.